It's a rural county with a relatively conservative board of supervisors most of the time, and a county that has to work really hard to find the resources sometimes to serve kids and families, right? It's rural California. And so some of the things they've done with their 2083 work is pretty amazing, and they're going to tell you about that. They'll set the context for this, and then along with one or two other counties that we know of, they've started on a journey towards trying to measure their outcomes together and what is their impact. And that's the theme of the afternoon today. So happy to introduce Michelle Clark, who's in her 21st year with Tuolumne County Health and Human Services. She's currently the Director of Social Services. She oversees prevention, welfare to work, child welfare services, post-permanency, complex care, and a host of other services, including adult system of care work. Annie Hockett is an LCSW. Began her work serving children and families in 2004 as an ER worker, and she is now, since 2016, with Tuolumne County Probation and is their Assistant Chief Probation Officer. So you got that right. An LCSW that started in social services and now is the Assistant Probation Chief. Betty Hoskins is a licensed clinical social worker currently serving the program manager for the Behavioral Health Crisis Access Intervention Program in Tuolumne. She has been providing various clinical services and supports to adults and children for 24 years and has some experience in other counties that's been enriching for Tuolumne in the last few years. So appreciate that. And Tyler Jackson, newly promoted, is in his third year with Tuolumne County Department of Social Services. Right now, is this the new or old title? Senior Staff Services Analyst. Old. Okay. Congratulations. Where he has led the development and early envisioning of the Children's System of Care dashboard underneath their 2083 work. So welcome to Tuolumne County.
Good afternoon. So I think I'll just start off before we dive into our dashboard pieces. I just kind of want to explain who we are as a children's system of care. I'm already loud, so maybe I should back up. Anyway, so it took us a while to get this going, but we have started, we have all been really, this is just a small portion of our children's system of care in Tuolumne County, but we have representatives attending on a regular basis from our health and human service. We are a health and human services agency that also encompass behavioral health. We also have our Tuolumne County Probation team, our regional center team, and then we also have County Office of Ed, I'm sure as all of you do. But we are also trying to get our juvenile court judge back engaged in our team. We've had some shifts with our court, but we did at one time have our judge as also a part of our children's system of care. And so we've also been starting to engage our tribal partners. We actually have very good collaborative partnerships with our tribal partners. They just haven't fully kind of gotten on board with this piece yet, but we continue to try to engage them in that. Just to kind of give a background and some, areas of growth for our interagency team. So when we kind of first started this, we tried to start doing this on our own kind of years earlier, and then we realized that we really just needed some help. So I really want to give a lot of credit to Richard Connect, an integrated human services group, and his team, in just really kind of bringing that neutral element to our county to just kind of really keep us on track and really just, get us to understand kind of what this process was. So we actually ended up just really focusing on that first year on our MOU development, obviously to kind of appease a mandate, but also our goal was really to, build an MOU that was actually a living document that, we all had a shared commitment in and that we would refer back to and live it. Obviously everyone, for compliance purposes, we want to have this MOU done, but we didn't want it to be a document that we just threw in the drawer and then forgot about for 2 years. So, that was one of our very first goals, and we were finally successful in doing that, and it did take a lot of work and a lot of time, but we finally got there, and we are in the process of building our new one with some tweaks. So, part of that MOU was making sure we had the right the data elements in it as well. And so that was a huge accomplishment for our children's system of care team. We also, it's been, just very elemental that we have had a really consistent commitment from our advisory committee and our interagency leadership team. It's been, the backbone. It has been regular, consistent. That has been a huge reason why we've been able to accomplish so much. I think another interesting part is that we don't really care who attends. We have, we have senior leadership and we have executive leadership, and we all kind of attend both committees, just kind of making sure that we all are there and continuing this momentum. So that's been, pretty amazing. We're a small county, so we've always had pretty collaborative, pretty great partnerships. So that's been great. Another thing that we have decided is, because the state is shifting, really we believe in prevention. We're trying to shift in that way. Well, prior to kind of FFPSA and those kinds of things, we actually decided to turn our interagency placement committee into a collaborative resource committee. And so we've really expanded it to be more to really support the community in prevention. And we had started doing that long before we even started doing our comprehensive prevention plan that our children's system of care is also, the governing body over. So, that's been pretty important in our county. We have started to really refer families to this collaborative so that if they're at risk, that we're really trying to wrap them with services and get to them a lot sooner. So that's a huge accomplishment as well. We've also finally agreed upon a universal release of information. That has been a huge accomplishment. Another thing that took some time, right? But we haven't started using it yet, but we are definitely, next phase is just to train on that release. So that's an exciting thing that we were really able to do together, and another shared commitment. Another big thing has been training on the integrated core practice model. So we've done a few trainings. We've had Richard and his team come and train for that. All levels. So that's been pretty exciting in our county as well, and something that, again, our system of care all agreed to and believe in. So pretty exciting there. Our next step really will be to hopefully start kind of identifying some county champions that can, actually start training on that we can continue to sustain that as we bring new team members on. The other thing that I think that is not identified on here, but we also were able to, through this process, is our family urgent response system. We have a very unique system in Tuolumne County, and we basically share it between behavioral health, probation, and social services. It's an on-call system. They rotate that on-call shared whatever. They rotate it. All of our staff members, they've all been trained in the de-escalation. We have trained the trainers. So another thing that we were able to do as a children's system of care. So pretty exciting stuff. And I thought, we thought that it would be important for you to kind of know where we are as Tuolumne County and where we were and where we have grown. So I'm going to go ahead and.
All right. So we'll go ahead and kind of segue into our dashboard. As we embarked on this work, we really wanted to make sure that we had some metrics that we could look at, really to determine if what the direction we were going was the right direction. Are we really hitting those outcomes that we were hoping to hit? And so that the development of the dashboard really kind of served that purpose. What you see here on this slide is actually taken directly from our MOU, and you can see that we embedded the actual data points in that. That was very intentional, as we really wanted to make sure that shared accountability was there across kind of all system partners. And that, as I mentioned, we really wanted to make sure that the data kind of informed our decision making and was really at the core of kind of all of this work. So when we started, we kind of said, well, what are we already collecting? As Richard mentioned, we're a small community and county, and so we had limited existing resources as it is, and so to kind of stand up a separate system felt daunting, quite honestly. And so we really kind of took a look at what are we already collecting, what systems do we already have to pull from, let's not kind of reinvent the wheel. And then from there, I think we also thought, well, how could this dashboard serve kind of dual purpose, not only the direction of this work, but also are there other times where we might need data that we can look to this dashboard? So we were trying to be mindful of that. Then we kind of just started throwing stuff out, quite honestly, right? We had just that popcorn discussion. What about this? How about that? And through that work, we had some really great discussions. We were able to say, well, if we focused on this, how would that impact over here? And so it kind of naturally, I think, broke down some of those silos that we all are used to sometimes working in. I think we also just really got a great understanding of our partner agencies. Because we had those discussions. Well, we don't collect this data because of this reason, or we can't collect this data because of that reason. So it just led to, I think, a really great, robust discussion. It certainly took some time, but we were able to, kind of whittle it down. I think probably at one point we had probably 100 data points. Maybe not that much, but it felt like a lot. And so again, through kind of those discussions, we were able to kind of have lots of dialogue and whittle it down to what we thought was going to be kind of the most useful. And I'll let I don't know if Betty wants to add anything about kind of her thought process of how that went.
I came back to Tuolumne County a few years ago, so they had already had a lot of this in development. So when I initially came to some of the first meetings, I asked for a lot of data points to come on there. So I'm probably the reason it went up to 100, because these were all things that I wanted to know how we could use these data points across systems, right? So crisis calls in the school, how's that affect behavioral health? Foster youth or maybe it was a youth that was foster but was also regional center. So we really wanted to look at kids that were affecting multiple systems. One of the big things for me is the hospital days for youth. So when he does do the example, we initially put in, it has hospital days for all youth, not just foster youth. So I think we do need to pare that down. But that also gave us an ability to look at our high-end utilizers or youth that began using hospitalization as a coping skill. So, and also looking at individuals that were impacting one system that were now going to potentially impact another system. It gave us opportunities to kind of meet and schedule them in other meetings, like Michelle was sharing, the IRC meetings, to provide more support to these families that were hitting these data points, and to see an individual that was hitting multiple data points that maybe we would not have recognized initially or have caught, to be able to share that information across systems. And not a lot of qualifying information initially, because again, it's difficult to share because of the HIPAA, FERPA, all of that. So getting the schools to share some examples, or even regional center, it's like, well, we can give you numbers, but not further identifying information. So that's something we're still working on. So, and
I think that originally too, we were kind of overthinking everything, because obviously we have so many different reasons for why we collect data in our own departments, right? And so really trying to figure out why we were collecting that data. So, I mean, it was really a lot of rich conversation, I think. Again, we just kind of kept throwing data points out, which I don't think is a wrong way to go. But, we finally were able to kind of help. And then we had our data mind right here, Tyler, who kind of really helped when he came on board, kind of helped us I guess, get our thoughts down, right? Like, we're not data people. I mean, we are, but we're not like statistic people, or stats people. So anyway, I don't think that it was a wrong way to go, but I think that the key is to not really overthink it. That was a lesson learned, because I think we did do that. But yeah.
So, let's see. So once, we had kind of our list and kind of the ever evolving list, probably quite honestly, we really wanted to make sure that it wasn't kind of one and done. And like Michelle said, we threw it in the drawer, didn't look at it again. And so what we did is we kind of utilized our advisory team to make sure that that conversation continued. So we had and have that kind of as a standing item on our advisory team agenda so that we can continually circle back and check in on how we're doing. We also are, I think, fairly good at like holding each other accountable. So when it's time to put data in, we're like, okay, everyone, like, what's the deadline and what happens if we don't meet the deadline? Or do you care if I email you and say you're late? We have those discussions through advisory team. As Michelle mentioned, Tyler has been instrumental, the support of social services to allow an analyst to be dedicated and do some of the cool work that you guys are going to see was really, I think, another game changer in all this. Michelle mentioned the use of the consultant. I do not think we would be where we're at today without that support. We are, as mentioned, small, rural. All of us up here wear like 7 hats on a given day, and so I think having that support and that ability to continue to focus on that vision was really instrumental. Michelle mentioned kind of the refining of the MOU and again, looking at that as a living document. That was certainly something that we tried to embody. We did do a retreat, which maybe we will rename that San Diego County. That was a good point you made there. But we have called the retreat, and that's what's on our slide, so we'll stick with that. But we started that, I think our first one was in November 2022, just as an opportunity to get together, to get in person, to get the whole team together, because some of our meetings, you don't have all the players all the time. And it was so successful. There was the desire to have those on a more regular basis. So we're going to aim for, I think, 2 a year. But at those retreats, we look at the dashboard and we have additional conversation. And Tyler has done some cool demonstrations of now that we have some data actually collected, can we start looking at those trends? What do those trends want us to know more about? And so that is certainly some rich conversation that comes. Michelle mentioned, don't overthink it. Again, I think there was value in our process that we had those discussions and it took a long time. But I heard not long ago someone said like data's like mushrooms. Like you see one over here, you run over and you want to like look at it. And then, oh, there's another spot over there. Let's run over and check on that. I know personally I felt that way sometimes during this process. Again, not that it was a negative, but to try to kind of stay focused, stay on point was a lesson that I learned. Yeah, and I think that's where I'll end that.
I'm going to stand up here so that I can do stuff. So yeah, when I came on, they had done all this nice work developing data points and collecting it and sort of making a habit of doing that, which I think is really important. But how do you move from a list of numbers to meaning, right? Ultimately, you want a dashboard because you want to track how things are doing, and then you want to make decisions based on those results, right? And so getting a multidisciplinary group of people to start thinking like that is a challenge. It's at first, but really just talking about the patterns and the correlations that we can see between the data, that's where we started. At the retreats, we look at graphs of each data point. We talk about it, what it might mean, so that we can represent it. And instead of just a list, we can attach meaning to it. Because ultimately, you want to take that data and use it to make policy decisions for the future. So I'm going to try to demo the dashboard, which is, dashboard is a nice word for it. So when I started, the dashboard was a Word document. and I've now made it an Excel spreadsheet. Yeah, so we have, I think we have 26 data points. There are some data points that are actually for programs that haven't started yet. And then there's a couple on this list that are from the regional center that are not, they're actually not on this list because those data points were, there weren't any data for that. But if you look here, this is just kind of a brief sort of, are things going up or down, right? So if you look at, let's see, so green is behavioral health, and then the beige is school. So if you look at the beige, so students placed in residential treatment via IEP, that's going up. Mental health care via IEP is going up. Mental health care through AWARE is going up. So those are obviously increasing. The AWARE program, that's a new program. And so there's a question there. Is that going up because there are more mental health crises in the schools? Or is that going up because people are becoming more aware of the AWARE program? And so questions like that are how you ultimately drive the meaning. So you find the answer to that. And I think the schools aren't here, but I think they would tell you that both of those answers are true. So partly mental health in schools is decreasing and you need more services there. And partly we have this program that helps connect students to providers. So another thing that I've done besides this is made, which is really hard to see, which is great. This is a correlation matrix. So this looks at all the data points and assigns kind of a percentage. Are they going up or down when compared to each other? And so there are a couple of things that I want to point out on this list. I can't really see this screen. Okay, there we go. All right. So if you look at that AWARE program right here, that's positively correlated with crisis services rendered at the school from behavioral health. And that makes sense, right? You've got behavioral health and the schools talking to each other through this program, and they're correlating positively with each other. Another one that I can point out that is interesting, foster care placement stability. So we have a negative correlation right here with inpatient mental health days. So that means when there's more inpatient mental health days, placement stability is less, right? And one thing I want to point out when you're thinking about things like this is correlation does not mean causation. So you are looking at data points across multiple systems, and they might not necessarily carry meaning when compared to each other. But the questions that you derive from those comparisons, that's where you get the meaning. So you ask those questions, and hopefully the answers lead you to make better decisions about how to prevent child abuse, how to help kids better in the future. And then actually, Betty, did you want to build on your comment there about?
Sure. So in looking at those inpatient days, really what we've been submitting is our total inpatient days for all youth, not specific to foster youth. So the number will be significantly less when that is corrected. So it may still affect placement stability, even for one foster youth that goes into a psychiatric placement. The current residence that he was in may no longer be able to provide the services that youth needs. So that's something, again, that's brought to our attention so we can address before they're discharged to see if the family that they're with is able to manage what their high needs might be.
Yeah, and another thing to look at on the correlation matrix is if you look at youth entering foster care. So there's some positive correlations that might be a little surprising or counterintuitive. So crisis services rendered at the school, that's positively correlated with youth entering foster care. And so that could be just a coincidence. It could also be that as you render more services at the school, more kids are entering care because they're exposed to an entry point in the system.
So in relation to that, sometimes we may provide crisis service and we bring the family in as well, and we're able to kind of ameliorate maybe something that's happening or get them to engage in services that can help with the stability. Not always guaranteed, but if the sooner that we're aware and able to provide those interventions sometimes makes a huge difference where maybe the family isn't disrupted.
Yeah, and so that leads to kind of a highlight of some of the challenges we face as a small county. We don't have a lot of data. We don't have a lot of people. I think there might be more people in this room than there are at the county. I'm kidding, but we are a very small county. And so ultimately, like over time, we might expect, just like Betty said, that as you render more crisis services at the school, you're going to see less kids going into foster care. That's the outcome we want to see. And so here it raises a question like, is there something with practice going on, or is it just a coincidence, or is it both? And the answer is probably maybe a little bit of both, but who knows? I mean, that's something that we have to investigate as a team. Other things that we as a small county face because of the small sample size is like if we have one family that comes into care and there's 5 siblings, that's going to change all of our numbers significantly when it's really just one family. And so taking that into consideration when we look at the data, because there can be high skews because of that. Another thing, we've only been doing this for 2 fiscal years now, and so we haven't really been able to suss out some of the cyclical nature of data. So do we have more kids entering care in the summer or less? And so are those increases related to a cycle or not? So that's something that we're taking into consideration going forward.
So as Michelle brought up with our FERS program, it is a partnership. We are able to provide like semi-crisis services for current foster or probation youth or any previous foster, probation, or adopted youth. We have had several calls in our community. It started out really slow, but I think in that partnership, we've been able to help with some of the stability, because if it's a current foster home or maybe even an adoptive home, being able to go up and provide that service and spend time with the family, the parents and the youth. We have seen some positive outcomes for that. As always, if we do go out and it is more of a crisis, like threats of safety or self-harm, it does shift from a FERS call to a crisis call, but still having that follow-up, whether it's the follow-up with the social worker the next day or following up with behavioral health as well. So that's been a really nice program, and always looking for more bodies to provide that service.
I think I just want to say that at the end of the day, with the dashboard, the data, I think it's just really important to have this component built in, because obviously we aren't trying to address a mandate. I think we are really trying to make sure that our system of care is functioning at its best, right? So I think that was kind of the ultimate goal, right? Like bringing this dashboard to actually serve what, its intended purpose is. And obviously we continue to kind of work through this process and learn. I mean, when Tyler was finally able to get us to see, like, just ask a question, right? Like ask a question that you wanted, like potential, like to investigate. And I think that, so at the end of the day, we just want to like use this data to continue to, argue for resources, improve our systems, and those kinds of things. So I think that I just want to say that that really is the importance of this data. And then, we're just still constantly trying to learn how to utilize it. So I just wanted to make sure that I say that and what the importance of having this was.
I think also the agency collaboration has been really helpful. Again, they're all our kids, so we want to make sure that we are doing our best for the families.
And we want to make sure our staff have the resources to, provide for. We want to try to keep our kids local, all of those things, everything that everyone is trying to do. So I think it's just really important to really keep the data element involved.
All right, so some takeaways. One thing, we established a set of data points that we revisit during advisory and also in ILT. Including the language in the MOU has been really important because if you want to change, it makes it harder to change your mind. We've formalized it. It's something that we're committed to as a system of care. And that's committing to those as a shared outcome. And then some functional analysis to identify the trends. That's kind of what I showed you there. And then also bringing up, the other day we had a discussion, an advisory team, the regional center was like, our numbers are 0. Is that okay? Is something wrong? And the answer was no. If the number is 0, then the number is 0, and then we take meaning from that. So maybe we need to do a better job of connecting to our regional center, and then engage your analysts, engage your in-house talent for helping, and start where you are. I am not a statistician, but probably none of they aren't statisticians either. And then we talk about it all the time, regularly. It's on the agenda, and then quarterly we bring it to ILT. So advisory is more like the core group. They have in-depth discussions, and then they bring highlights of those discussions to ILT so that decisions and investigations can be made. And then that's it. If you have questions.
Okay, I think we got a couple minutes for questions, and I'm wondering, the font was small enough on that screen that I wonder, Tyler, if you could read off like 4 or 5 of those matrices from that. Yeah, just give us a sense give us a sampling, like 1 or 2 from each area. Just read it out loud for us. Give people a flavor for what the ecosystem of data looks like.
Suddenly I forgot how to read. So mental health inpatient days, that's all youth. I'll just go from the top. Average number of inpatient days for foster youth, number of children in inpatient, average number of days from the request for mental health services to the first mental health appointment, total youth readmitted to inpatient care, youth in full service partnership care, youth in, what's TBS? Therapeutic behavior services, crisis services rendered at school, out-of-county foster youth transferred with an open case, and number of children connected to behavioral health. And then I talked about mental health services through the AWARE, but also through IEP and ERMS, and then students placed in IEPs or in residential through IEP. Some of the child welfare data, so youth in residential or SDRTP, youth entering foster care, the FERS calls that we were talking about, foster care placement stability, youth receiving wraparound, which is foster youth getting FSP, and then the number of youth in ISFC level care. I skipped over probation. Probation youth in mental care and probation youth in private mental health care and probation youth in residential.
Thanks, Tyler. And so if we're understanding, then your next steps on this, these really basic data, is to begin to deepen the conversation around what those early trend lines might mean. If you look at one of those trend lines, it says that the number of kids placed in residential care by school districts in Tuolumne has tripled in 12 or 18 months. Is that a problem? It's a problem financially for school districts, right? And so it invites a conversation back to your ILT or your executive group about, well, what does this mean, right? And we can begin to think as a collaborative, whose responsibility are those kids? It's not just the school district, right? Because we're one system. Michelle, I can see you wanting to maybe comment about, no, okay. Questions, reflections on this early dashboard challenge for us as a system? Anybody want to throw something out there? We got a couple minutes. Yes, hang on one second.
Hi guys, I'm Un from Yolo County, and you just got our brains kind of going over here, and we're looking also at the California Cradle to Career. The data points that you have, is there alignment in it, or is there a way for it to plug in? Like, how do you foresee your data points being used, maybe alongside or in the Cradle to Career data system?
So that's an educational data set largely, right? Yeah, and so their ed partners are not here from Tuolumne today, so it may be a question that's beyond our panel, in all honesty, right? Because Cradle to Career data is somewhere else. But I think the question's fantastic, right? Like, they invested in this wonderful interagency early iterative data set, but there's an existing data set that could inform that, or it's something coming, right? So once again, we're not integrated at the state and federal levels around reporting and outcomes. We got work to do, right? Great question. Thanks for that. Yeah.
Sorry, can't answer it. I've never heard of that.
Hello, thank you for being here and sharing your data journey with the group here today. My name's Daniel Norton Luna, and I'm coming from Up Valley Family Centers in Napa County, and it's really cool seeing the different systems of data put together. And I was just kind of wondering, hearkening back to the conversation from this morning, where's the children or the youth and family voice in what kind of data metrics you were interested in looking at or highlighting?
So they were not here this morning. Just kidding. So
She's our default answerer.
So in looking at this data, I think it is important. Families they are oftentimes concerned about how often their kids are getting hospitalized, what services are available. We have not been at the point where we've shared this data with youth and families yet. That is something that I imagine is going to be coming as we provide more trainings and outreach efforts to say that this is some of the things that we have discovered and be able to bring them to the table to have further discussions around that. I personally do have children that are affected in these data sets with regional center and hospitalizations. And so that is important to me as a parent to see those things, to know that, that it's not unique, maybe that this is happening, but with the school offering more services, that's also important. I think getting the information out to youth and families is really important, and I think getting them to the table will be the next steps.
Yeah, thanks for that. A great question from Napa. One can imagine, if you think about the places where you currently do a community engagement, system improvement planning, performance improvement planning, public health has a bunch of community engagement processes where they have to use data, right? Schools do this through LCAP, I think, and at least a couple other places. You could imagine, once this data gets a little more sophisticated and trustworthy, valid, verified, you then begin to take this data into those settings, right? And have a much richer conversation with parents, youth, community-based organizations around the implications of your shared decisions, right? So they're early in it in Tuolumne, but you can imagine the next generation is it really deepens the conversation around, well, what do we do with our resources together, right? Yeah, really great question, Napa. One more
Richard,
question.
can I just piggyback on that? I think to answer the question, that's a discussion that we recognize we are needing to bring that forward. One of the challenges that we talk about is we don't have a large pool of people wanting to participate in some of this work, and so we're having to go out and seek that out. And so we've been talking, okay, well, as we're starting to work on this project, we need someone with lived experience on that. Does anybody know anybody that would want to participate? So, I talk to colleagues in larger counties, and they have like a list of folks that are knocking on their door wanting to be involved. That is not the reality that Tuolumne County has, which is probably helpful in some situations, but it's definitely a conversation we're having, recognizing how do we get to that point, because we recognize how important that is. So thank you for that question.
And I just want to also add that we are just in the very early stages of implementing kind of our comprehensive prevention plan. And so I think that we might hopefully be able to those are some of the data points that we haven't started tracking yet that we actually have identified as part of our dashboard, but we just don't have numbers yet, obviously. So I think that hopefully as we start to do that, maybe, again, a great question, right? And then I think also hopefully with the family voice, our entry to care, or is it going down, and why, what's working and why, right? So again, it's all these wonderful questions that I think that we all kind of try to bring up. So I think it's a great point.
Hi. I'm Tammy. I'm a family advocate with Paradise Oaks Youth Services. It is important to collect the data. We collect data for the county. Our program is located in Sacramento County. They have a focus group that they pull together to review it, and they report it out. Have you thought about possibly going into the school system and maybe incentivizing, having families, that are to have children that attend, the age groups that you're trying to target, and pulling a focus group together that way?
So that's actually an element of our system improvement plan and county self-assessment anyways, through the Child and Family Services Review. So we're actually starting that again, our 5-year cycle. And so those are some things that we will do, but I think that we have discussed doing it more often. And I know we have actually just added another analyst position to really try to focus on our continuous quality improvement. And we're actually kind of hoping that that's going to be a more consistent process. Again, as Annie was saying, we all wear so many hats, right? And so I think that is one thing that has really been hard in a small county, is we do all of these things to be in compliance, and really trying to make it a more organic process is a struggle sometimes. And so just trying to, figure out how to put those infrastructures in place is something that we continue to try to brainstorm, and I think has been a really big part of our discussions as an advisory committee and an ILT. So all of these things, these have been discussions. I just think that we're continuing to try to build that capacity. But yes, we need to do that. We do have our surveys built into our child and family teaming. And so now just trying to really take that data and do something with it. Again, but we do have some things built in. Just really trying to integrate it is, what we're trying to get to, I think.
Right. So the big takeaway is if you have an Excel spreadsheet and a Tyler, you can get something done, right? So one more round of applause for Tuolumne.